Hello, guys. So here we are again at pharmacology, and the topic that we have for today would be about anti-infective agents. So we'll talk all about anti-infectives and what they do to the microorganisms that are trying to invade our body. So the development of anti-infective therapy started out in the 1920s from Paul Ehrlich, who worked on developing a synthetic chemical which is effective against infection causing cells only. Scientists have discovered penicillin from a mold sample. This mold sample um, is known as the Penicillium notatum. That's the scientific name of the mold. And by then, once it was discovered, it was used later on during World War II to treat wounds to prevent it from having an infection. Also, in 1935, the first types of sulfonamides were also introduced. But long before these developments happened, during ancient times, I've also read from our books that ancient people already have been using molds to treat infections, and it really was helpful during those times. But in the early 1900s, Paul Ehrlich, together with also Alexander Fleming, they have discovered the advantages of using anti-infectives. Before the 1900s, people die early. They they die as early as 30s, 20s because of bacterial infection. Before, tuberculosis was untreatable. It was considered like AIDS during that time, wherein if you have TB, they stay away from you. If you have leprosy, they stay away from you because you are communicable to other people. But now, with the invention of anti-infectives, these diseases, which were previously untreatable, have become treatable. Who knows? The viral infections that we currently have during this age, maybe later on, scientists will be able to manufacture certain drugs that can treat these viral diseases. Mechanism of action of the different anti-infectives that we have is number one, it interferes with the biosynthesis of the bacterial cell wall. So every now and then, the bacteria synthesizes proteins in order to maintain the cell wall. But some of the anti-infectives and antibiotics, they interfere with it. Or number two, they prevent the cells of the invading organism from using substances essential to their growth and development. So there are certain drugs, most especially in the antivirals, they stop certain substances. I'll discuss that further once we are in the topic of antivirals, on how they stop or how they block certain substances that are essential for the growth and development of viruses. Number three, it also interferes with steps involved in the protein synthesis. So there are also antivirals that does this, and I will explain more of them once we get to that topic. Number four, it also interferes with the DNA synthesis. These microorganisms, they also have DNA, they have proteins, and certain anti-infective drugs, they do these things in order for the cells of these microorganisms not to proliferate. Because if it stops synthesizing DNA, it'll no longer reproduce. Number five, it alters the permeability of the cell membrane to allow essential cellular components to leak out. So what happens here is that they destroy the cell wall or the cell membrane of the microorganisms, causing it to die because the components, the organelles of bacteria, for example, or protozoans, they will leak out of it, and eventually that microorganism is going to die. So we have different areas where anti-infectives act on inside the cell. So they can go into the nucleus and disrupt the DNA synthesis. Sometimes, some of them, they disrupt or alter RNA synthesis. They also block certain nutrients, such as the nucleosides in antivirals. They do that. And they destroy the cell membrane. They disrupt the cell membrane, causing all of these components inside the cell to leak out of it. Now, anti-infective activity. First is that anti-infectives vary in their effectiveness against invading organisms. There are several groups of anti-infectives that we have, and most especially antibiotics. They have their own job to do. They have differences. Some of them can be bacteriostatic, the others can be bactericidal. I'll explain these differences once we get into that topic. Some of them are selective. They are effective only for a small number of organisms. Like, for example, there are certain antibiotics such as cephalosporins that are only effective against certain types of microorganisms. They also have their generation as well. First generation, second generation. For the first generation, they have a limited amount of bacteria that they can kill. Second, there are additional groups of bacteria that cephalosporin can treat. Third, fourth, there will be more bacteria. It has a brighter scope. The higher the generation of the cephalosporin has, the broader the scope of bacteria that it can kill. Now, this is what I was talking about earlier. Bactericidal, these are antibiotics that will kill the cell. And bacteriostatic, these are antibiotics that prevent the reproduction of the cell. Always remember these two terms. Cidal, side is to kill. And bactericide, meaning it kills microorganisms or bacteria. Well, bacteriostatic, stasis, they stop. Stasis meaning stop. So it stops what does it stop? The reproduction of the cell or the bacteria. So those are the two types of the mechanism of action of antibiotics. It can either be bactericidal or bacteriostatic. Now, spectrum versus broad spectrum. This is the one that I was talking about earlier. Number one, narrow spectrum of activity. This is effective against only a few microorganisms with a very specific metabolic pathway or enzyme. A great example would be that of the cephalosporins. Like what I've said, the earlier the generations, the lesser bacteria that they can kill. The newer generations can kill a wide variety. That falls now into number two, broad spectrum of activity, which are useful in treating a wide variety of infections. That's why doctors, they are trained to prescribe which type of antibiotic that they can give to a patient. That's why we patients, we must not take antibiotics for granted. We need to seek the help from our doctors because they know what type of antibiotic is helpful against the bacterial infection that we currently have. Because if we self-medicate, that is dangerous, because if we will medicate ourselves with antibiotics that you just know or heard of, for example, you can cause these microorganisms to have, let's say, a resistance to certain types of antibiotics. That's why it's very, very important to seek or to consult a doctor if you are having an infection, most especially if that type of infection is bacterial. That's why nowadays here in the Philippines, you are no longer allowed to buy antibiotics without a prescription. You need a prescription for it in order for you to buy it from the pharmacies. Human immune response. Number one, the goal of anti-infective therapy is to reduce is the reduction of the population of the invading microorganism. It will just reduce, it will not totally kill all of the invading microorganisms that have or that is in our body. It will just reduce the population. In turn, our own immune system is going to fight it off. The antibiotics or the anti-infective agents will only be there to help reduce the population. Number two, drugs that eliminate all traces of any invading pathogen might be toxic to the host as well. So it's very, very important for the doctor to regulate the dosage, depending on the weight again of our patient. Number three, immune response is a complex process involving chemical mediators such as leukocytes, lymphocytes, antibodies, and locally released enzymes and chemicals. If you recall your anatomy and physiology, there are certain chemicals that are involved in the inflammatory process if an invading microorganism is present. Leukocytes, or the white blood cells, will be there to help battle these invading microorganisms together with the other enzymes that are present in the body. So that is the immune response of our body against these invading microorganisms. The goal of anti-infective therapy is just to reduce the population, not to totally eliminate them. Problems when treating infections in immunosuppressed patients. So problems like this can occur. Anti-infective drugs cannot totally eliminate the pathogen without causing severe toxicity in the host. There are certain patients that are immunosuppressed. Who are they? Let's say, for example, cancer patients who are taking in anti-neoplastics, or patients who have leukemia. Another would be patient who is suffering from AIDS or acquired immunodeficiency syndrome, those who have HIV. So these patients do not have the immune response in place to deal with even a few invading microorganisms. So it would be very hard to treat it since their immune system is really not functioning well. That is why if we have patients who are having these kinds of diseases, such as those who have cancer, taking anti-neoplastics, leukemia, AIDS, they should be placed in reverse isolation once they are confined at the hospital. Or one of our teachings that we can do to patients who are immunosuppressed, they should always wear a mask when they go out. But since we have the pandemic right now, all people going out are wearing a mask. But since there's a pandemic, it's not advisable for people who have immunosuppression to go out. Or they should also avoid eating raw foods, such as raw meat, raw fruits and vegetables, because they can get infection from these as well. And of course, avoid people who have signs and symptoms of an infection. Like, for example, there's cough, there's fever, there's body malaise, and so on. If they know family members in the house that has these signs and symptoms of infection, they should stay away from them, or else they will have the disease as well, since their immune system is not functioning that great. Resistance. This was one of the things I've mentioned earlier. Anti-infectives act on a specific enzyme system or biological process, and many microorganisms that do not act on a specific system are affected by the particular drug. This is considered natural or intrinsic resistance to that drug. So what happens here, that's why there are some bacteria or microorganisms that do not respond to certain types of antibiotics because these antibiotics may be narrow spectrum. They can only treat a few species of bacteria. That's why they are resistant to it. Or, let's say, for example, the Streptococcus bacteria, or Staphylococcus rather, Staphylococcus aureus. Before, it really was not that resistant to certain types of penicillin. Now, since penicillins were taken for granted by some patients, some of them do not finish the medication with the prescribed amount of days, prescribed amount of time by the doctor. The consequence here is for these bacteria to develop a resistance. That is why it is very, very important for us to educate our patient that if they take antibiotics, they should finish the total number of days that the doctor has prescribed in order for the infection to be totally treated. Because if they just, let's say, for example, the patient was prescribed 7 days to take penicillin or methicillin, and the patient's signs and symptoms disappeared for just around 3 or 4 days. So since the patient no longer feels any of the signs and symptoms, the patient decided to stop taking the medication. That is wrong because it can create or the bacteria can be resistant to the drug that it was exposed with. So later on, that Staphylococcus aureus, which was previously resistant to methicillin, is now called, they are now called as MRSA, or what we call as MRSA, methicillin resistant Staphylococcus aureus. That was that because they produce enzymes that will deactivate methicillin. So it is very important for us nurses to tell the patient to finish the prescribed amount of days that the doctor has told them to. If they are going to take an antibiotic for 7 days, they should finish it at 7 days. If they have TB or pulmonary tuberculosis and the doctor has prescribed to take it for 6 months, they should take their anti-tuberculars for 6 months. And they should strictly take them every day. Or else the consequence is the development of this, the drug resistance. So acquired resistance, microorganisms that were once sensitive to that particular drug, this was what I was explaining earlier, have begun to develop acquired resistance. This results in serious clinical problems, such as the one that I've mentioned, MRSA, or methicillin-resistant staph or Staphylococcus aureus. Where resistance develops, number one, they produce an enzyme that deactivates the antimicrobial drugs, such as penicillinase. There are certain microorganisms that can produce penicillinase, which will deactivate penicillin. So that is very dangerous if you are infected with a bacteria that is resistant to penicillin. Number two, changing cellular permeability to prevent the drug from entering the cell. So they have developed that as well. Their cell membrane has become more tough and it doesn't allow the antibiotic or anti-infective to enter it. Number three, altering transport systems to exclude the drug from active transport into the cell. So it's another way of stopping the entrance of the drug molecule into their cell. Four, altering binding sites on the membranes or ribosome, which then no longer accept the drug. So there are certain sites wherein the drug attaches to into the bacteria or virus, which causes the death of that microorganism. But now, the bacteria or certain microorganisms evolved to change those binding sites, which no longer accepts the drug that it was intended for. Number five, producing a chemical that acts as an antagonist to the drug. So they now produce chemicals that will antagonize the drug and deactivate it. Force, they will no longer die if one of these five has evolved from a microorganism. So that is a big problem later on within the medical industry if microorganisms or more microorganisms develop any of these five resistance from drugs. So how to prevent resistance? Number one, limit the use of antimicrobial agents to the treatment of specific pathogens sensitive to the drug being used. So if it's a narrow spectrum, or if that bacteria is not, or if that drug rather is not being used for that bacteria, then the doctor should prescribe a drug that is efficient against killing that specific type of bacteria. Because how is that antimicrobial going to kill the drug if it is not intended, or kill the microorganism rather, if it is not intended for that microorganism? Number two, make sure the doses are high enough and the duration of drug therapy is long enough. So the doctors should calculate the drug dosage based on the patient's weight. That is very, very important here. We should base the dosage from the patient's weight, most especially if the patient is overweight or the patient is a child. And they should specify the duration of drug therapy, whether it be 7 days, 14 days, or 6 months. They should specify it. And patients need to strictly conform to the drug schedule given to them by the physician. Because aside from the drug prescription, they will tell you to take it 3 times a day, one in the morning, one in the afternoon, one in the evening, for example, or let's say every 12 hours. So they should strictly follow the schedule and the duration of drug therapy. It is our role as nurses to teach patients how to strictly conform to this schedule. Number three, be cautious about the indiscriminate use of anti-infectives. That is why they are being regulated right now. Pharmacies no longer sell drugs or sell antibiotics or any other anti-infective agents over the counter. You need to buy anti-infectives with a prescription, because there are certain patients before who have been using anti-infectives indiscriminately, or they are just taking it for granted. They don't know what type of bacteria they have in their body, and they are using, let's say, for example, first generation cephalosporins, and that bacteria is not present in or in the treatment of the treatment plan rather of first generation cephalosporins, then that will be a big problem later on because that drug is not treating the patient's infection. Identification of the pathogen. Number one, identification of the infecting pathogen is done by culture. So they are going to take a swab test, like what they are doing right now during the pandemic. Swab tests are done to identify whether you're positive or negative from COVID-19. Or others can be done through the sputum exam. They're going to collect a sputum from a patient in order to determine the type of bacteria that is present in the patient's respiratory system. If the patient is exhibiting signs and symptoms of respiratory infection, such as in tuberculosis, that is the most definitive diagnosis for pulmonary tuberculosis. It is the sputum exam. Take note, the most definitive diagnosis for pulmonary tuberculosis is the sputum exam, not the Mantoux test, because in sputum exam, that is where the medical technologists are going to identify for the presence of Mycobacterium tuberculosis in the patient's sputum. Number two, a culture of a tissue or a tissue sample is from the infected area is done. It can either be through a swab or of infected tissue, and they are going to grow it on an agar plate, or staining techniques and microscopic examination, which will identify the bacteria as well. So they're going to obtain a tissue sample. Let's say, for example, if you have leprosy, they're going to do the slit skin test and identify if Mycobacterium leprae is present from the skin. So that is one way of identifying the type of pathogen that is present in a specific body tissue. Number three, stool exams can also be done, such as fecalysis, in order to determine for the presence of ova, these are the eggs, of parasites that are present in the GI. So if your intestines are infested with parasites, you'll learn that later on in microbiology and parasitology, the different parasites, Ascaris lumbricoides. You also have Trichuris trichuria, Taenia solium, Taenia saginata. What else? There's a lot. So you have roundworms, tapeworms, and so on. If they are, or if the stool is present with ova or parasites, they will determine that as well under the microscope. Sensitivity of a pathogen. Number one, shows which drugs are capable of controlling the particular microorganisms. This is what they're doing or testing during clinical trials on how to test a new anti-infective agent, whether it has the capability to kill that microorganism. Number two, important to be done for microorganisms that have known resistant strains, because there are certain strains of microorganisms now that have evolved to become resistant to certain types of antibiotics, such as penicillin, methicillin, and others. Number three, along with the culture, it identifies the pathogen and appropriate drug for treatment. So they determine now which drug is appropriate for that type of pathogen that has been identified through a culture. Factors affecting prescribing anti-infective agents. Number one, identification of the correct pathogen. This should be done first. It should the doctor should know first what type of pathogen is currently infecting the patient for the doctor to know what kind, this is now number two, to select the right drug for that pathogen. The right drug is one that causes the least complications for that particular patient and one that is most effective against that pathogen that is involved. Combination therapy, so there are certain drugs that are combined together, such as antibiotics. Number one, use of a smaller dosage of each drug. And some of these drugs are also synergistic together. So they help each other out in treating or combating the infection. That combination therapy is done most especially to patients who have pulmonary tuberculosis or patients who have leprosy. Number three, in infections caused by more than one organism, each pathogen may react to a different anti-infective agent. So if they found out in the culture examination that the patient is infected by more than one pathogen, they can also use combination therapy in order to treat the infection of the patient because the patient may be having multi-bacterial infection. Number four, sometimes the combined effects of the different drugs delay the emergence of resistant strains. So this is also one of the things combination therapy does. It will delay certain, or it will not cause some bacteria to develop resistance against certain anti-infectives. Adverse reaction to anti-infective therapy. One is kidney damage, most especially if the doctor has prescribed a high dosage of the drug. Number two, there are certain drugs that can cause gastrointestinal tract toxicity. So there are certain antibiotics later on that I'm going to discuss that should be taken in with food because they can irritate the gastric mucosa. So I'll teach you that later on once we go to that topic. Some of them, number three, can cause neurotoxicity. So they can cause toxicity, most specifically the peripheral nervous systems. Some patients might feel tingling sensations of their extremities, numbness, and so on. Four, this is one of the issues related to anti-infective therapy. Hypersensitivity reactions or allergies are very, very common in anti-infective therapy, most especially antibiotics. There are some patients who have allergies to certain types of anti-infectives. And number five, superinfections. Superinfections can occur because not only do the antibiotics kill the invading pathogen, they also kill the normal flora of a certain bodily system. So let's say, for example, the E. coli of our GI tract. If that bacteria is killed by the antibiotic that has been taken in by the patient, this can cause untoward effects on the patient as well, causing superinfections. Superinfection is brought about by antibiotics that has killed the normal flora of our body. Anti-infective agents are also used as a prophylaxis. When we say prophylaxis, we are already giving drugs to the patient in anticipation of a possible infection that might occur on the patient. That's why there are certain patients that are given prophylactic treatment in order to prevent the occurrence of an infection. That is the goal of prophylaxis. When we say prophylaxis, we are giving patients drugs in order to prevent the occurrence of an infection. So for example, if you are traveling here in the Philippines or in a province here in the Philippines that is endemic with malaria, let's say for example, there are certain provinces in the Mindanao area or certain mountainous regions here in the Philippines where malaria is endemic, you need to take anti-protozoal or anti-malarial prophylaxis in order for you to prevent the development of malaria. Or patients who are undergoing gastrointestinal or genital urinary surgery, or any type of surgeries. If a patient has undergone a major type of surgery to prevent the occurrence of an infection, the doctor is going to prescribe the patient to take in antibiotics. This serves as a prophylaxis in order for the patient to avoid getting an infection after a major surgery. And lastly, patients with known cardiac valve disease, valve replacements, and other conditions requiring invasive procedures. So anything that will, or any kind of surgery, invasive procedure that is going to be done on the patient, the doctor needs to prescribe anti-infectives as a prophylaxis in order for the patient not to develop an infection. So that's the purpose of giving prophylaxis. So that's it, guys, for anti-infectives. Our next topic would be on antibiotics. Please do an advanced reading on it and also learn the different prefixes and suffixes of the different antibiotics that we have in our books. So again, thank you very much for attending today's session regarding anti-infectives. Again, if you have any more questions about our topic for today, please do not hesitate to send me a message. Thank you and have a great day.